The cost of a long-term illness or other health condition that will require an extended stay in a long-term care facility is one of, if not the largest unknown expense that a retiree may encounter as they age. According to the Long-Term Care Association, 1 in 5 seniors over the age of 80 has a complex healthcare need that can only safely be met in a long-term care facility. And according to Statista from survey data gathered in 2021, 40% of long-term care stays are between 1 and 3 years, 21% are between 3 and 5 years, and 14% of stays are greater than 5 years. While many seniors may be fortunate enough to avoid needing enhanced care services in retirement, the risk is still significant enough that retirees should be discussing how they would respond in the event that the need for this type of care arises. In this video, we will cover the health conditions that may necessitate a stay in long-term care, the different types and levels of long-term care support in Canada and their associated costs, and how retirees should be planning for the potential costs and lifestyle impact that a move to long-term care will bring. And if we haven't met yet, my name is Mark Walhout, and I created this channel to share ideas and concepts that I'm using to help people with retirement every day. If you want to get more videos like these, consider subscribing to the channel and hit the bell icon so that you're alerted when new videos are posted. Many retirees can rely on the occasional assistance of their spouse, friends, and family members if their health situation worsens as they age. Help with meals, cleaning, visits to the doctor, and companionship are roles that can be filled with family members pitching in to help when needed. But for some retirees, the health decline becomes severe enough that spouses, family, and friends can no longer provide the level of care needed to support their aging loved one. Health conditions that necessitate a move to long-term care typically fall into 2 broad categories or a combination of these categories. The first category is a physical impairment. Typically, when a retiree is no longer able to perform the main activities of daily living, they may require ongoing help in the form of long-term care. The main activities of daily living are bathing, dressing, toileting, eating, and transferring, meaning moving from a car to a house or between floors in their house. The second category is cognitive impairment. According to the Alzheimer's Society of Canada's landmark study conducted in 2022, 8.4% of Canadians over the age of 65 had some form of dementia. They project that by 2050, 13.2% or 1 in 8 Canadians over the age of 65 will be living with some form of dementia. Of those impacted, 1 in 4 will require levels of medical and social support that may go beyond what family and friends can provide. So what options are available for Canadians who require some form of long-term care? Let's talk about the 3 main forms that long-term care can take for a Canadian retiree, as well as some of the costs. We'll start with in-home care. In this scenario, a retiree would have certain healthcare services administered in their home. This is most suitable for a retiree whose desire is to stay in their home as long as possible, also known as aging in place. This is common in scenarios where there is a married or common law retiree couple living together and only one member of the couple requires higher levels of healthcare services. In-home care situations are highly customizable. Services such as meal delivery, laundry, cleaning, dressing, skilled nursing, physiotherapy, and many other services can be received in the home. In Ontario, where I live, these services may be subsidized by the provincial healthcare system, subject to undertaking a thorough health assessment and the availability of those services in your area. For those who do not qualify for provincial support, these services can be purchased privately. Sun Life has a very useful guide that walks through the different levels of in-home care, associated costs, and even a couple of case studies so that you can get familiar with your options here. One of their examples describes a single retiree requiring some meal delivery and some assistance with bathing and dressing, with an approximate out-of-pocket cost to the retiree of about $1,700 per month. Another example describes a retiree couple requiring all meals, all bathing, nursing care, house cleaning, and dressing with an approximate out-of-pocket cost of $8,900 per month. Keep in mind that receiving long-term care health services in your home may require you to make certain renovations to your home to make it more accessible. Some enhancements may include widening doorways, installation of ramps and lifts, and reconfiguration of bathrooms in order to make your home wheelchair accessible. The next option is private retirement residences with long-term care options. In this scenario, the retiree would move to a private condo-type retirement residence that has optional care add-on services that can be purchased on an as-needed basis. According to Sun Life, the monthly rent for retirement residences in Ontario range from between $2,700 a month to $13,000 a month, with a median monthly cost of $5,050. The cost of additional in-apartment services would be added to the monthly rent cost and will vary from residence to residence. For planning purposes, using the care scenarios we talked about in the previous section, expect that additional on-site healthcare costs could add several $1,000s per month to the retiree's ongoing rental costs. At first glance, this option stands out as very expensive. Keep in mind, though, that most retirees who select this option will fund the rental and care costs through the sale of their home. Be aware that wait times for private retirement residence can be very long, up to several years in some cases. And finally, there are provincially subsidized long-term care residences that will include the cost of rent plus the cost of ongoing care. In order to qualify, applicants must be unable to perform 2 of the activities of daily living that we discussed at the beginning of the video. In Ontario, the portion of the cost that the client needs to pay is just over $2,000 per month for a private room. Services such as cable, internet, telephone, and transportation services can be purchased for an additional fee. Low-income Canadians can apply for a means-tested rate reduction on their monthly fee. Wait times for provincially funded long-term care homes are around 200 days in Ontario, and that is from the time of a completed and approved application. So be prepared for a lengthy wait time for this option as well. So far, we've talked about the conditions that could lead a retiree to need long-term care assistance in retirement, the different types of long-term care services available, and their associated costs. Now let's talk about how to plan for a long-term care need in retirement. Step number 1, talk about how you and possibly your spouse would deal with the need for long-term care in retirement. In a perfect world, what would your preferred option be? Would you prefer to stay and have healthcare services delivered to you in your home? And at what point would your answer change? For example, if the care need rose above a certain level, would you then prefer to move to a retirement residence with those care options available on site? Or how would that answer change if one member of the couple is no longer here? Step 2, plan for the long-term care need. Though there is a chance that this may never happen, it is still good planning to anticipate how you would respond financially in the event that a long-term care need arises in your retirement. There are many ways you can plan for this. Here is one real-life example of a case study that I just went through with a client late last year. In our discussion, we established that it is very important for the couple to stay living in their community, close to their kids, grandkids, and church community. Furthermore, they did not want to have to rely on their kids to have to provide support since they themselves have heavy commitments with children and careers. The couple decided that if one of them required health services that the other couldn't provide, their strong preference was to have those services delivered to them in their home. We then talked about what would happen if one member of the couple was gone. They mutually decided that the remaining member of the spousal couple would be content to sell their home and move into a retirement residence with long-term care health support services on site. We modeled into their retirement plan 2 years' worth of in-home long-term care support services when the first member of the couple turned age 80, based on an intermediate level of care including companionship, house cleaning, and meal preparation. The additional monthly cost of about $5,000 per month for 2 years totaled $120,000, and we based this estimate on the Sun Life Long-Term Care Guide that we discussed earlier in the video and that I've linked below in the description section. We then agreed that in the event that the long-term care need for the first member of the couple became more severe than an intermediate level of care, that they would sell their primary residence and use the proceeds to move into a private retirement home and purchase additional healthcare services as needed with the proceeds. Your needs and plan may be entirely different. I encourage you to check the resources I've included in the description section below, including the report I've referenced from Sun Life, as well as the Comfort Life directory that will allow you to search for retirement homes that offer assisted living and memory care options in your area, along with budgetary pricing. Step 3, communicate with loved ones. One of the hardest parts about a transition to a long-term care situation is getting on the same page with loved ones. I've seen families struggle with getting their elderly loved ones to accept help from an outside care provider or to move to a long-term care situation against the aging family member's will. One way to ease into this conversation is to start early and to start small. For example, if you see yourself or your aging parents starting to struggle with mobility, consider getting some help brought in for laundry and cleaning services. If the need progresses, you can begin to layer in additional services on an as-needed basis. Evaluate your need or your family member's need at least annually and talk about how you will respond if the need for care increases. Starting to plan early is very important. Due to the long wait times for services and availability of spots in retirement and long-term care homes, and also to give yourself and your family members time to weigh options and prepare emotionally for a potentially significant life change. Thanks for watching this video all the way to the end. If you like it, give it a thumbs up, leave your questions and comments below. Thanks again, and I'll speak with you soon. Take care.